Today we are going to talk about bluetongue disease in sheep. Bluetongue is a noncontagious, vector-borne disease caused by bluetongue virus, or BTV, a double-stranded RNA orbovirus. It is transmitted mainly when an infected Culicoides biting midge feeds on a sheep. It is not normally spread by casual contact, and it does not infect people. After entering the skin, BTV replicates in local immune cells and draining lymph nodes before entering the bloodstream. It travels in mononuclear cells and associates with red blood cells, helping maintain viremia. The virus targets vascular endothelial cells lining blood vessels. Viral replication and inflammation damage these cells, causing leakage, hemorrhage, microthrombi, poor tissue perfusion, and necrosis. This explains facial edema, oral erosions, coronary band inflammation, pulmonary edema, and muscle damage. Clinical disease usually appears several days after infection. Sheep may develop a fever of approximately 40.5 to 42 degrees Celsius, or 105 to 107.5 degrees Fahrenheit, followed by depression, weakness, reduced appetite, rapid breathing, and reluctance to move. The lips, muzzle, jaw, and tongue may swell. Excessive salivation, tearing, nasal discharge, crusting around the nostrils, and difficulty eating or swallowing are common. The mouth may be intensely red, with hemorrhages, erosions, or ulcers on the lips, gums, dental pad, and tongue. Despite the name, a blue or cyanotic tongue is uncommon and usually reflects severe swelling and impaired blood flow. Coronary bands may become red or purple, producing painful coronitis, stiffness, and lameness. Severe cases can develop diarrhea, dehydration, froth at the nostrils, pulmonary edema, muscle necrosis, abortion, stillbirth, or death. Infection during pregnancy can damage the fetal nervous system and produce malformed lambs. Recovering sheep may lose weight or develop a break in wool growth. Bluetongue cannot be confirmed from appearance alone because foot and mouth disease, contagious ecthyma, peste de petits ruminants, and other diseases can cause similar lesions. During fever and viremia, refrigerated EDTA whole blood should be submitted for real-time reverse transcription PCR, which detects viral RNA. Serotype-specific PCR identifies the virus type, while virus isolation demonstrates infectious virus. Competitive ELISA detects antibodies, but a positive result may reflect previous exposure or vaccination rather than active disease. In dead sheep, spleen, lymph node, bone marrow, blood, and affected lung tissue may be tested. Suspected cases should be reported promptly. There is no antiviral medication that eliminates BTV, so treatment is supportive. Affected sheep should be rested in shelter, handled gently, offered soft feed, and given easy access to water. Fluids may restore circulating volume and correct dehydration and electrolyte losses. Veterinarian-directed nonsteroidal anti-inflammatory drugs inhibit cyclooxygenase enzymes, reducing prostaglandin production and therefore decreasing fever, inflammation, and pain. Antibiotics do not act against BTV, but may be prescribed for secondary bacterial pneumonia or infection of damaged oral tissues. Drug choices, doses, and withdrawal periods must follow veterinary guidance. Prevention requires reducing susceptibility and midge exposure. Vaccination should match the circulating BTV serotype because protection between serotypes is unreliable. Authorized vaccines should be used, especially in pregnant ewes. Midge exposure can be reduced by housing sheep during peak activity, using fine insect screening, applying approved insecticides or repellents according to the label, and reducing wet, manure-rich areas or standing water that support breeding. Movement, testing, quarantine, vaccination, and surveillance requirements should be followed. If you have topics you want to suggest or donate to our game and video development, reach out to dogtoursgame@gmail.com.